Unless I go on long rants, I don't think I'll be 15 minutes. But I am going to perform precisely what Ian and Alex just criticized. So isn't this going to be interesting? I managed to live with a level of risk around the possibility of being HIV positive to a level that was acceptable to me for the first 20 years or so of a sexually active life, which has been great. And I specifically said to a level that I'm comfortable with. We just had an illustration just walking over here from across the street of a point that I often make, that we all have a different level of risk that we're willing to live with. I often say some people always cross the street at the intersection, at the crosswalk, waiting for a green light. Other people are perfectly comfortable in between corners, weaving through traffic. In crossing from the coffee shop across the street to here, Patrick was about to go through cars, and I walked over to the corner and waited for the green light and crossed at the intersection. Like, see exactly my point. However, I noticed in a couple of years before I started PrEP, which was a year and a half ago, that some of my behaviors were changing. And I was no longer able to manage my risk around my sexual health, including around HIV, in a way that I was comfortable with. I've been working in HIV for about 20 years. Most of the last 12 years is focused on HIV prevention. So I knew off the top of my head what were some of the factors that kind of predicts someone becoming HIV positive, and you have a lot of literature showing this. So I started to look at my own behavior in that sort of objective way. So multiple sexual partners, check. Partners who are HIV negative, HIV positive, and of known HIV status, check. Not always using condoms, check. History of STIs, check. If you look at the literature, this is a classic list of who's at risk for HIV. So I did a lot of self-reflection as to why I suddenly had this shift in my behavior, and why I was no longer feeling comfortable with the way I was managing my risk around this. I've been aware of PrEP for a number of years. Those of you who've been around in the HIV field for a while may remember the controversies around some of the very first PrEP trials that were shut down. Ironically, a trial among sex workers that would have given us an answer to this question probably about 10 years ago, if it had proceeded. But it was shut down. Actually, there were two shut down, one in Cambodia and one in Western Africa, for all kinds of good reasons, because actually the preparation of the trial and the work with the community was not really done very well. So I've been tracking on this for 10, 12 years, except that for those of us who work in HIV, there's this sort of mental thing that we do all too often, is that when we think about community members, it's always other people. It's never about us, as though we're not part of that community, either as HIV negative or HIV positive people. So it's those people. So always when I would look at PrEP stuff, it was about these potential other people who were at risk of HIV. So I actually went back and reread a number of resources that I'd already read, but this time thinking about them in terms of my own personal experience. And what is interesting is that, and this happens a lot for people who are exposed to the idea of PrEP, initially I certainly thought it was a very bad idea indeed, and didn't think that it would really make much of a difference, that it's not something that we should make available. And all of a sudden I was finding myself a few years later considering it for me to use personally. One of the very first things I looked into was the question of cost and coverage. If I had to pay $900 a month out of pocket, that was a non-starter right at the beginning. But because of a number of issues that were raised by others, I'm in a very privileged position in many ways. Although I don't have private insurance, I happen to live in the province of Quebec, which means that the Q would cover most of the cost of the drug. And the remaining $83.83 a month, I felt I was able to cover myself. I also have access to a doctor. I have a doctor, which is not everyone. I happen to have a gay doctor, which is not everyone, because you have to have a conversation with your doctor who's going to agree to a prescription that includes admitting certain behaviors that perhaps it's not comfortable for everyone to talk to with their doctor. He also works in HIV, so he actually knew about PrEP. So all of that greatly facilitated my access and is far from being a universal experience. To say that I was ambivalent about starting PrEP at the beginning would be a gross understatement for all kinds of reasons. I wondered if I would start to take on more risk than I already was as a result of being on PrEP. I was also very torn and remain conflicted about this whole idea that was raised by others about why is it that I would have access to PrEP when the majority of people living with HIV in the world don't have access to treatment. How fucked up is that? And to see how easy, relatively, it was for me to access PrEP is completely ridiculous when you consider, again, the majority of people globally who need access to treatment don't have access to it. I had some concerns about the toxicity and the side effects, but I experienced some of those. And also, another issue around cost was not just can I afford it out of pocket, but we're all paying for my PrEP out of our pocket as taxpayers. And so I had a lot of questions about that. Like, is it really, am I worth it to having this cost covered by everyone else? In the end, despite all those concerns, I decided to start PrEP about a year and a half ago. I haven't experienced any side effects. I haven't really seen any changes in my own behavior since being on PrEP. Rather, and this is common to a number of people that I've encountered who are in PrEP, is that PrEP was introduced at a point where already my behavior had changed at that point. As far as I know, I've never missed a pill in the last year and a half. And PrEP for me remains one of a number of strategies that I mobilize in terms of managing my own risk around HIV and STIs. Condoms, in some cases, are still a part of that. Knowing what the effect of treatment on viral load is for people who are HIV positive was before I started PrEP and remains now an important strategy for me. Zero sorting, but not in the sort of traditional kind. I think a lot of negative guys have come to understand that if you're going to have condomless sex, doing so with someone who's positive with an undetectable viral load is a much safer bet than with someone who says that they're negative and may think that they're negative, but they might not be. Zero positioning in some cases, managing numbers of partners. So it's been added to a number of prevention options that I use. Really the biggest impact for me in terms of my own life for using PrEP has been, as was mentioned earlier, a reduction in fear and anxiety around HIV. I haven't experienced any side effects other than that quite positive one. And for me, even though I mentioned that I was able to manage my risk in other ways before, the fear and the anxiety remained there. There's an American blogger, Mark S. King. He has a blog called My Fabulous Disease. And he wrote in the last year an article called something like 10 things that positive guys want negative guys to know. And then he also did a follow-up video where he interviewed a number of HIV negative guys. And so I was watching that video, and the guys were talking about their relationship to HIV as negative guys. And a number of them, of course, talked about, you know, the fear and anxiety and the stress around HIV. And it hadn't sort of dawned on me until I watched that doesn't exist anymore for me. And I never thought after 20 years that there would be a time where I can be sexually active and not have that fear and anxiety go hand in hand with it. I've been experiencing for the first time when I'm sexually active what it's like to not have that fear and anxiety all the time. And that's been quite transformative for me over the past year and a half.